Hello and welcome. Today we're delving into Huntington's disease, a devastating inherited disorder that affects the brain. We'll explore its causes, how it impacts the body, and what can be done to manage this condition. Prepare to learn about a complex and challenging neurological disease. Huntington's disease is primarily caused by a genetic defect on chromosome 4. This defect involves an abnormally long expansion of a CEGA repeat sequence within the Huntington gene, or HTT. This gene provides the instructions for making the Huntington protein. Everyone has CEGA repeats, but in individuals with Huntington's, the number of these repeats is significantly increased. When this mutated gene is passed down from a parent, it leads to the development of Huntington's disease. The mutated Huntington protein, produced by the faulty gene, accumulates in brain cells. This abnormal protein disrupts the normal function of neurons, especially in areas like the basal ganglia, which controls movement, and the cerebral cortex, which is involved in thinking, perception, and memory. Over time, this accumulation leads to neuronal damage and cell death in these critical brain regions. The progressive loss of these neurons causes the characteristic symptoms of Huntington's disease, affecting movement, cognition, and mental health. Huntington's disease is estimated to affect approximately 3 to 7 per 100,000 people of European ancestry. It's significantly less common in some other populations, including those of African or Asian descent. Because it's an inherited disease, if one parent has Huntington's, each child has a 5% chance of inheriting the mutated gene and developing the disease. There is no gender predilection to the disease. The signs and symptoms of Huntington's disease typically emerge between the ages of 30 and 50, but they can appear earlier or later in life. The disease manifests in three main categories: motor, cognitive, and psychiatric. Motor symptoms often include involuntary movements called chorea, muscle rigidity, slow or abnormal eye movements, and impaired gait, posture, and balance. Cognitive symptoms involve difficulty with planning, organizing, focusing, and making decisions. Psychiatric symptoms can range from depression and irritability to obsessive, compulsive behaviors and, in some cases, psychosis. Diagnosing Huntington's disease usually involves a combination of a thorough clinical evaluation, a detailed family history, and genetic testing. Neurological examinations assess motor skills, balance, and coordination, while cognitive and psychiatric assessments evaluate mental function and emotional well-being. The definitive diagnosis is confirmed by a genetic blood test that identifies the expanded CEGA repeat sequence in the Huntington gene. Brain imaging, such as MRI or CT scans, may be used to rule out other conditions and assess the extent of brain changes. While Huntington's disease is a single condition caused by the same genetic mutation, there are variations in the age of onset and the severity of symptoms. Juvenile Huntington's disease, which occurs before the age of 20, is typically associated with more rapid disease progression and different symptom presentation, often involving rigidity and seizures rather than chorea. The number of C8 repeats in the Huntington gene can influence the age of onset, with longer repeat lengths typically leading to earlier onset of symptoms. Currently, there is no cure for Huntington's disease, so treatment focuses on managing symptoms and improving quality of life. Medications can help control chorea, depression, and other psychiatric symptoms. Physical, occupational, and speech therapy can assist with movement, balance, and communication difficulties. Counseling and support groups can provide emotional support for individuals with Huntington's disease and their families. A multidisciplinary approach involving neurologists, psychiatrists, therapists, and other healthcare professionals is essential for comprehensive care. Since Huntington's disease is a genetic disorder, primary prevention isn't possible. However, genetic counseling can help individuals with a family history of Huntington's disease understand their risk of inheriting the gene and their options for family planning. Preimplantation genetic diagnosis, a PGD, is an option for couples undergoing in vitro fertilization, allowing them to select embryos that do not carry the mutated gene. Huntington's disease is a progressive and ultimately fatal disorder. The rate of disease progression and the lifespan after diagnosis vary among individuals, but the average survival time is typically 10 to 20 years after the onset of symptoms. Recent research is focused on developing therapies to slow down or halt disease progression, including gene silencing techniques and strategies to reduce the accumulation of the mutated Huntington protein. Clinical trials are ongoing to evaluate the safety and efficacy of these novel treatments, offering hope for future therapies that could significantly improve the lives of those affected by Huntington's disease. Thank you for learning with us today.